I'm Harold Cox, and I want to welcome you to today's program. On behalf of our Dean, Sandro Galea, I want to welcome all of you here, but in particular, I want to welcome you all back to school. I hope that you have had a wonderful summer, and I hope that your school year will be a very good one. Right before this particular program that we're having right now, there was another session that we held in just the room off to the side for people who are interested in the area of working in governmental public health. So we joined with our career services group in having students talk with individuals who are on the front line of doing public health. And I want to acknowledge the people who came and spent their time with us today. And I want to do that in actually two groups. So the first is to introduce the people who are from, and some of those individuals had to leave, but some of them were able to join us today. And the folks who are from DPH and from Boston Public Health Commission, from the Department of Public Health and also from Boston Public Health Commission. If there are any of those individuals in the room who participated in this program, if you'll please stand, please. Okay, great. So, what I want you to know about these individuals is how hard they work. They are on the front line of doing work to take care of all of our health. And I happen to have a really good understanding of this because I sit on both the boards of the Boston Public Health Commission as well as the board of the Massachusetts Public Health Department, and get to see firsthand these individuals at work. So I really appreciate you coming and sharing your time with our students. I'd also like to invite those individuals who are fellows of the local Public Health Institute to also stand. So the Local Public Health Institute, LPHI, is a training institute that we run here at Boston University. And the institute provides scores of trainings for individuals who do state and local work. The fellows are individuals who have received that distinction because of several reasons. One, because they work in state and local departments for some significant amount of time, as well as they have demonstrated that they have a mastery of public health concepts and practices. They have shown a commitment to their own professional development, as well as they have shown a commitment to doing stewardship of public health through our state. But the reality is the fellows, as well as our colleagues from Boston Public Health Commission and the Department of Public Health, are the best of the best. So I'm really very glad that you were able to share your time with our students today to help them to understand more about public health. Thank you very much for being here. Today's presentation is about AIDS. AIDS has indeed impacted all of our lives, some individuals directly, families, friendship circles, communities, cities, states, countries. All of us in some way or the other have been impacted by HIV. And we thought that it was very important to have a conversation then about the early days of HIV. Because as there are many people, many of our students who are interested in this content area, what we recognize is that because of their age, very few of them were here at all. So it's important that we continue to tell those stories of how complex it was and the experiences that we had during that early period. We have, as part of this experience then also, we've brought a couple of the AIDS panels that are here, and they are in the building next door. The AIDS Quilt, as you will know, is a memorial to individuals who have died from AIDS. Each of the panels is 6 by 3, which is the average size of a coffin. And then those panels are then sewn together with a larger number of others, and they are put together in sections of 12 by 12. There are now thousands of these 12 by 12 sections, and my understanding is that the total panel, the total quilt weighs something like 54 tons at this time. we were very fortunate to bring 2 of those 12 by 12 sections to our community today for you to be able to reflect on the individuals who have gone on before. To help with the conversation today, we have a number of people who are here. Now, the important thing is that you have to be of a certain age, that's i.e. old, in order to have been able to be part of this conversation. I would never say old to my colleagues, but they are. So, but I am so very, I'm sorry, seasoned. These are seasoned and mature individuals who have joined us today. I'm just going to, I could take a long time to introduce each individual one, but I'm not going to do that. And just I'm going to give you a name and a title so that you have some sense of the breadth of experiences that individuals have come with. We are going to spend some time talking among ourselves, and then we're going to invite you into the conversation as well. And at a later point in our program, we're going to invite the chaplain of the university, Dean Bob Hill, to join us to guide us in an experience of remembrance for those individuals who have gone on before, as well as recognition of those who continue to struggle and continue to work in this area of HIV. But let me tell you who our panelists are. This is Nancy Norman. Dr. Norman is the Medical Director of Integration at the Massachusetts Behavioral Health Partnership. This is Gary Bailey. Gary Bailey is a professor of practice and also the director of the Urban Leadership Program at Simmons School of Social Work. On the end there is Dr. Al DiMaria. Al is the medical director of the Infectious Disease Bureau and Laboratory Sciences, and as well as the state epidemiologist for the Massachusetts Department of Public Health. Next to Al is Pat Doust, who is the director of, Pat, raise your hand so that they won't miss you. I didn't want them to, I didn't want them to miss you. It's Pat Doust, who is the director of nursing for global health at Massachusetts General Hospital. And next to Pat is Andrew Fulham, who is the Associate Director of the International Division and the Director of the Center for HIV at John Snow, Inc. Now, there are lots of things that we could say about all of these people, but the thing that I really want you to know is that they are smart, they are passionate, they are caring, they are advocates, and they're all friends of mine.
Well, we used to be.
Well, oh, okay, not so old. These are all friends of mine. All right. So we thought that the best way for us to start this show was to show you some individuals who we know, and to talk about those individuals as a way of giving you a sense of some of the people who have been very important in the AIDS world. Yeah. Okay. Who wants to talk about Larry? Pat.
Is this on? Oh, it is on. Larry Kessler, my hero, my mentor, the person who really was responsible for me delving into this world of HIV and AIDS many years ago in the early 90s. I, at that time, was a nurse, still a nurse, doing palliative care. And hospice at that time was primarily caring for people with end-stage cancer. But we then began to get a couple referrals, and they were young men, and they were dying of AIDS here in the Boston area. And it was quite a scary time. And my agency was, like many others, refusing to care. They said we didn't know very much about the disease, how it was transmitted. We're not going to put our team at risk. And it just felt very wrong. So I actually heard about this agency, AIDS Action Committee, in the basement of Fenway. And I called and I asked if there was someone who could come out and train our staff about transmission. And so out came a couple wonderful young men, and they told us about transmission, universal precautions, infection control. And once we were educated, that we had a responsibility, an ethical responsibility to provide care. Unfortunately, my boss continued to refuse. So I decided to quit and called AIDS Action. And God bless the folks at AIDS Action. They took me on. In fact, David Aaronstein, who's in the room, actually was one of the first people to interview me. Yep. I won't tell you the whole story, but I think he was looking at me saying, who's this woman from the burbs? Like, she doesn't know anything about our community. Okay, she's a nurse. She might understand the disease process, but, well, we're going to give her a shot. So I ended up working at the AIDS Action Committee with a colleague, Louise Rice, a nurse, and we went throughout Massachusetts, because of funding through the state, to educate healthcare providers about this disease. Because you could not refuse, but yet the discrimination, the stigma, was incredible. Primarily young men, but also women were being refused care. People were not going into their hospital rooms. And many of them were dying alone if they didn't have a colleague by their side who understood. Even family members were refusing. So eventually, I moved on from doing the statewide education to becoming the Director of Client Services at AIDS Action. And I followed in the footsteps of Harold Cox. And I remember coming up one day and they said, you better get those high heels even higher, girl, because you've got big shoes to fill.
Did I have on high heels? Is that what happened?
And so it changed my life. It changed my family's life. I do remember a conversation I had with my husband in the early days saying, I had fear about transmission. And we looked at each other and said, you can't say no to this. This is what we have to do. And it was just such the right moment. And I could not have been more welcomed by anyone more than Larry Kessler. He wrapped his arms around me and welcomed me, knowing that I did not know very much about the gay community. I had a lot to learn, but I guess he trusted me some way. But I'll tell one funny story and then I'll pass the mic on. There were only 2 straight women at the time at the committee, and he could not keep us straight. He would always call me Laura, and I would say, no, my name is Pat. And he's like, I can't tell the difference between you two. I actually told that story at his retirement party, and he never let me forget it. But Larry wasn't just my hero. He was a hero for so many. The lives he saved, the example that he gave. He marched in the street. He advocated until things changed. And to this day, even though his health is not great, he continues to be an advocate for the bigger, broader community. And yeah, he definitely changed my life.
Thank you, Pat. Anyone else want to just one brief reflection on Larry?
I had the opportunity to be Larry's boss as board chair.
And there's no such thing as Larry's boss.
There wasn't. That's what I quickly learned. But it was an interesting moment in time to be the first African American board chair of a major AIDS service organization in the United States, and to work with Larry Kessler. And I think that we made a great team. One of the things that I can say about Larry to this day is he's one of the most humble people I have ever met, given all of the things that he has done for so many. And one of the things that would make Larry so upset was when people would deify him. We would go to fundraisers and other things, and people would want to meet him and say, oh, you're so amazing. I mean, you're an angel, you're this, you're that. Larry hated that. But I needed to take the angel in the room so that I could get into their pockets to get the money to run the agency. And so it was that sort of ability of us working as a team that was just so amazing. And I learned a great deal from Larry that helped me to go on to be an executive director myself, what it means to put your staff out in front and not always have to be the person who's out in front. Larry is someone who has a wicked sense of humor. And my quick Larry Kessler story is we would always start the walk together. So we would greet the walkers as people were leaving. And but what no one really knew was that somewhere in the back there was a little car waiting for us to take us around the Esplanade, because that's the way we used to go back in the day. And so we'd be brought around, and the walkers, we'd be there to greet them as they were coming back over the bridge. And people would wonder, how did you get there so quickly? Well, we had really moved very quickly in a golf cart because Larry wasn't going to be moving that quickly. But we felt it was so important to be there to cheer people on who were helping to raise funds for organizations. Back then, we were raising money that we then had a process that decided that those funds were used for other organizations, so that we would raise, the walk monies would come in, we would raise the funds, and then we would have a process by which we would then distribute those monies to organizations. And we needed the walkers. And it was so important for Larry to be front and center in all of that.
Thank you. Belinda Dunn. Yeah.
I'll start on this one because I think for me, meeting Belinda and hearing about her struggle with the disease helped to diversify the understanding about HIV. And for me, even as someone who for years worked as Director of Women's Health at Fenway, my first clinical job was at a community health center in Dorchester, and my first HIV positive patient looked just like Belinda. And that was in the face that I think our community, no matter what their understanding was of HIV and AIDS, that wasn't the bigger picture. It was still very much thought of as a disease that affected mostly gay men and mostly white gay men. And so it really, I think, helped to add a voice to the conversation and add a voice to what was needed from an advocacy perspective around services and support from a host of different agencies. I mean, I think of Belinda as she was an amazing woman, a warrior, an advocate. The list is long, I think, in using similar words to describe her.
The thing I would add to that is Belinda was someone who came to the AIDS Action Committee primarily interested in the issues of people of color, as well as issues around substance abuse. And she was incredibly important in helping to talk to church groups and getting them to understand and the importance of thinking about this. And this is a woman who had a tremendous amount of style, and we saw this mostly as we went to Belinda's funeral. She was laid out in a fully open casket, completely in red. This was Belinda, and she had told us that she wanted a hairdo, and Belinda had her hairstyle. She might have done it herself, as far as I know, but she had a hairstyle that we could always remember. But it said something about who Belinda was. That was the way she lived her life. Let's go on. The person on the other side.
That's Michael Richmond to the right. This is Harold.
Without my high heels.
Without his high heels.
Sure.
Yeah. Michael Richmond was someone who really was a pioneer in moving the conversation about the epidemic out of places that many people did not always feel comfortable being. So creating an organization, MOCA, Men of Color Against AIDS, where indeed people within the African American community and other communities of color could really begin to come out, if you will. You have to remember this period of time, and I've written about this recently. There were so many times when you would go to a cancer funeral and nobody would talk about what someone had died from. Or I remember a friend of mine who I knew had AIDS, who was African American, and who stood and argued with me that what he had eaten was some bad ham. I'll never forget this conversation, and it had made him sick because there was such denial and fear and embarrassment about what was happening. And to have an organization and to have someone like Michael, who was out there, to have someone, also another picture that should be here is that of Sidney Borum. Sidney Borum, who was a good friend and a pioneer, and who were out about their status, but also who were taking charge in our communities about this epidemic, and saying that it wasn't just that AIDS Action was the only game in town, and I'm a great supporter of AIDS Action, but that cultural competence was also important, and the lived experience was important, and that there was a need to be able to connect these things in some different ways. It doesn't mean that one was better than the other, but it meant that we needed all of these pieces at the table during that period.
Let's move to the next one.
So I'm going to embarrass her as well. Sophie, please stand up. Everybody. So I started off in HIV not here in Boston. I moved here in '99, and Sophie is one of the first people I met. And I'd been hired here. I had come here out of international public health, and I had dropped out of international public health. I had been doing HIV work and doing clinical trials and being told that people who tested positive as part of coming into a clinical trial in Zimbabwe were not eligible for treatment because it wasn't standard of care in Zimbabwe. So we were telling women, thank you for enrolling. We can give you nothing, but here's a card for hospice care, best of luck. And I had fought the fight to try to get this ad, and I'm like, I'm out. So I'd taken refuge in Massachusetts and come to work for DPH. In an exciting time, we were doing HIV surveillance, but we were sort of flipping the bird to CDC. We were going to do it our own way. We didn't have to kowtow to what you were doing. And I met this amazing woman, Sophie Lewis. And Sophie ran the Consumer Bureau within the Office of HIV. And for me, this was a mind shift for me, that within government, there was a group of people who were responsible for reminding us every single day that these were not cases of HIV, these were not agencies, these were people with real stories, and everything that we did impacted their lives, and they deserved our respect, and they deserved a voice at the table, not window dressing to come and sit and, oh, and here's our nice HIV positive person, and then just, oh, just please sit in the corner. Sophie and others in that group were tireless about reminding us about that, and she gave power and authority. And for myself, I was HIV positive, but I sort of skirted around telling my story, but watching Sophie tell her story gave me the confidence to tell my story, which I think has helped me be both a better public health advocate, but also a better manager. And so Sophie is, she's my hero, and she's one of my best friends. And I'm going to stop there.
Well, I'm not going to stop there. I just want to acknowledge that I happened to be in the audience at an International AIDS Society meeting in Barcelona. And I saw this man stand up and say, I have something to tell everyone. And this auditorium was packed. And he said, I am HIV positive. And he held up his meds and he said, until everyone across the globe has access to these medications, I will never stop my work. So, Andrew, that was yours.
And I have the great pleasure of working with Sophie, more now than ever before in the department. So, and I think that, and as Andrew made very clear, to have the credibility and the commitment and the focus on what's important really is the reason why Sophie's work stands out so much. And looking back to 1990, when the AIDS Bureau was created at the Department of Public Health, it was really one of the first state health departments that created an organization within the department that was focused specifically on HIV/AIDS. When the federal government was pretty much still ignoring a lot of what we were trying to deal with, the Massachusetts Department of Public Health created, and people like Sophie really built a structure that focused on not only the consumer needs, but the needs of providers and what needed to be done from a policy standpoint. We were very fortunate over those years, starting with Dwayne Draper and the AIDS office, and then John Arbach, the first director of the HIV/AIDS Bureau, through Jean McGuire, Kevin Cranston, and now Don Fukuda, having brilliant leadership in guiding those programs.
One more. Ryan White. So the Ryan White story is perhaps some that many of us who are involved in HIV certainly know that name, Ryan White. Ryan White was a young kid who contracted HIV from a blood transfusion, and when he was out sick for a while and then he was ready to go back to school, they wouldn't let him back in school. And Ryan essentially started a movement just because became very popular because of what it meant to prevent young people from being able to go to school. And the issue of stigma became very, very clear. And very shortly after Ryan went back to school, did he actually get back? He died right before he got back to school, right? Yeah, it was just a couple of months or so before he went back to school. But Ryan is someone who many programs, and certainly one of our very important funding sources from the federal government, is named after Ryan. And people hear that name and say that name all the time without having a real understanding of who this very brave and a very important young man was. So these are just a few stories, and indeed many. You want some more?
I was just going to say, and also his mom. His mom was a tireless advocate from Midwest America who made this an issue because at the time it was 4 H's. If you had HIV, you were a hooker, a Haitian, a homosexual, or hemophiliac. And if you were it was very stigmatizing, and his mother was tireless in that effort.
Yeah. Could we reflect some more on this whole issue around stigma and fear, and kind of how you experienced that as you were in the early days? Al?
You know, I think it's right. Even with all of the unfortunate examples of recent time, it's hard, I think, to really realize how bad things were back in the 80s in terms of people's attitudes and some of the issues that Pat brought up, people actually refusing to care for people and having colleagues say and do things that at the time seemed unconscionable and seems unimaginable now. And I think the full impact of that, you know, when you're in the middle of a crisis, you don't have too much time to reflect. You sort of are dealing with what's going on. But in reflecting on that, it's a time that there were great heroes and also, unfortunately, very terrible things that happened to people.
It was also a period during which you would be, it was not unusual for me to go to visit a friend who I'd hear was in the hospital, and to go to their hospital, Mass General or Beth Israel or the Brigham, and their meal would be outside of their room because the nurses or the staff would not put the meal inside. I had to dress in a hazmat suit in order to go inside of the room. I was reminded of this. I'm not a great fan of the term triggering, but I was triggered during the Ebola scare by thinking, I've been here before in terms of this kind of fear and what it meant to have to put on these gowns from top to bottom to go inside to take food to my friends who, how were they supposed to get out of bed, who were in isolation and whose families were not necessarily coming to see them. So it was not only the stigma of the medical community, and fear is a natural thing when you don't know how something is necessarily transmitted, but I also think humanity is a natural thing. And watching people who were in need of a human being, someone to say, damn it, I don't know. It's not that I was so unafraid, but I just knew that I was more afraid of what would wait for me if I didn't step into that space to do what needed to be done. And it was not unusual for dentists or undertakers or barbers or this or that to not want to touch someone who had HIV. So it is not surprising that people would say, and we're talking now about AIDS, that people would deny that they had it because, in effect, they were going to be isolated. And it was a very, very frightening time.
And on the flip side, you're listening to the story around AIDS Action. I lived in Washington at the time, so 85 is the year. I was 19. I had liked boys since I was 15. When I was going to the big city, it was going to be exciting. And then HIV comes along, and it becomes scary and incredibly scary. But it was also, people came together. No one was out. No one was taking care of you. There were no AIDS bureaus. There was no Ryan White program. So communities came together to take care of themselves. And so there was a coming out and I lived in Washington, like I said, hugely homophobic city. Being out about being gay was political suicide in the Reagan years in Washington. You would end your career. And so you didn't do it, but you galvanized around Whitman Walker. You'd go work at Whitman Walker at night, and you'd do HIV counseling. You would do testing counseling when that became available. You did other counseling. You did other work. But then you scattered during the day, and you didn't talk about where you had been at night. You didn't talk about what you were doing. But it did bring communities together, and I wasn't part of it, but taking on the FDA and demanding drugs and drugs that helped people. And it's largely people who educated themselves, came together because the system wasn't working, but people came together and they found a way to work together and find passion around something that was incredibly important to them individually and to their community. So while there was the stigma and everything else, it was also a great galvanizing that happened, particularly as a gay man, a great galvanizing.
And I think, though, that it always seemed like there were a host of different forces behind that galvanizing community. I mean, there was this urgency to try and figure out what is this entity that's making so many young people so ill and killing them so quickly. And I think the part that really stood out for me as a person who was evolving as a healthcare provider during that time was, this very sometimes confusing mix of energy around what's the real stigma here. Is it the stigma that's connected to the disease, or is it the stigma, hearing Andrew talk about those 4 H's, we're not talking about the same 4-H club, we're talking about 4 H's and, how for folks, even with a Ryan White picture and how it affected folks who had hemophilia and got exposed to the disease via transfusion. The piece that still resonated for the majority, I think, of our culture was, the homosexual hooker piece. And so that was that was the huge stigma. That was the piece where, as healthcare providers, you were doing this work around fighting the isms that make our society so ill while you're still trying to help this person who's dealing with the disease. And I think that's really a big piece that brought so many of us together behind this redefined community of especially healthcare providers becoming more both understanding, more culturally competent, and using their voices to move forward things that could improve outcomes.
Nancy, let me take us to the next level in kind of talking about this issue of community, and in particular talk about the issue of the importance and the power of what happened in the community when it came together. But in particular, I want to talk about the chasm that occurred between white gay men and people of color, and the issues that were so evident as we talked about communities that were beginning to come together, and the struggles, though, of who's in charge, who has the money, who's involved. How do you keep something on the front page?
You know, one of the things that I say to my students at Simmons is that oppressed people learn to oppress. And so it is not surprising to me that within the LGBT community that there was a schism, that there was an enormous difference, and particularly here in Boston, where race matters so greatly. Unlike places like Washington, Philadelphia, and that's not to say it didn't matter in New York and all those places, but there was just such a balkanization of community here and a sense of isolation. And so when you had an organization that was growing like AIDS Action was at the time, and I came to be involved with AIDS Action through working with David Ehrenstein, through the Minorities Services Advisory Committee, I think it was, David, and walked in, and basically I'm the kind of person that looks outside, and every organization I'm a part of because I have complained about it. And years ago, I promised myself that I was going to stop being one of those complainers and I was going to be a change agent. So if it was something that mattered enough for me to complain about it, I needed to get involved and do something about it. So I got involved with the Minority Services Advisory Committee. And out of that, being able to say, wait a minute, there are other ways of beginning to think about the voices that are missing. Mm-hmm. How do we do that? So, and there was a willingness from David and Larry and others, Cheryl Schaefer, who's not here, where AIDS Action reached in and was able to, Harold Dufour Anderson is a name that should be lifted up, who worked to create, which now still exists, the Bayard Rustin Community Breakfast. You know, the first breakfast, the breakfast is now held in the Kennedy Library. It fills the Kennedy Library. I remember when we sat around in chairs in a circle at Club Cafe. So I've been around long enough to remember how we started to where we are now. But we were beginning to talk to each other, and AIDS Action said this is important enough to be able to support it. But we still have to be vigilant to talk about the issues, the pre-existing conditions of racism, sexism, heterosexism, classism. All of those things still exist within our larger communities, and they existed within the gay community. And to pretend that they didn't also rewrites history in a way that doesn't serve it well.
I have to mention, you mentioned Harold Dufour Anderson. So when I worked at the AIDS Action Committee, there were these two guys, happened to be both black, named Harold. And someone came into my office and said, you know, I was just talking to Harold, and said, well, no, I'm Harold. Said, no, I was talking to the refined one. So, with the French accent. Yeah, with the French accent, and who wore the mask, what's that, you know? Ascot. I was saying mascot. He was a. Al, what is your earliest memory as you think about AIDS?
Well, I was at Boston City Hospital at the time, and we not only didn't have cell phones in those days, we still had rotary phones. I remember distinctly, and I remember all of a sudden, where people had started to notice. I think you know, even several years before the first description of clusters of pneumocystis pneumonia and Kaposi sarcoma, people had noticed there were unusual infections happening, especially in certain populations, and we started to be aware. And then with that publication, all of a sudden, many of these cases that people who were taken care of already clearly had AIDS. And remember, in those, we're talking about 81, 82, 83, nobody knew what caused this syndrome. And nobody was even doing surveillance for AIDS until several years later. So there was so much that we didn't know, that sort of overwhelmed everything else. Hmm. And so it became almost anybody with some unusual kind of medical presentation became a suspect AIDS case because, maybe they had it because we didn't know what it was. We didn't know what the full spectrum of disease was. And then if I really go back, I remember I trained in internal medicine in the Bronx, and I remember distinctly as a senior resident having a gay man with disseminated CMV infection, and we couldn't figure out why he had it. This is back in '77, and I'm almost certain we now know why he had it. And I think there were a lot of cases. I remember having a conference, probably in 1980, about how we were seeing tuberculosis present in unusual ways in people from Haiti. And I'm now sure that that's what we were seeing. But it really wasn't until probably the late 80s that, and certainly after the identification of HIV in 84, 85, that we really started to pull things together and figure out what was going on. And then by the time I joined the Department of Public Health, one of my first jobs around 1990 was to go around and do these big conferences on Saturday morning with primary care providers to talk about how we had to mainstream HIV care into primary care. And the reason why we were doing that was because there were predictions there was going to be this huge heterosexual epidemic of HIV infection, and because that's what was happening all over the world. And the resistance and we would virtually get run out of town by the end of the session. And that was how much people did not want to deal with it, it's not my problem. And then what actually happened was there was recognition that people weren't getting very good care unless they were being cared for by people who were specialized in the care of HIV infection and AIDS. And sort of the entire policy shifted. And now I'm going around and giving some grand rounds on HIV infection, and I'm realizing that the people I'm talking to don't know about PrEP. They don't know about treatment as prevention. They don't know how well people are doing, because now HIV care is so much specialized after all of these years still that the general providers in the community still aren't involved in taking care of people with HIV infection.
This is a conversation that always moves so incredibly fast as we think about this, but I would like to invite those of you who are in the audience to either help to share a reflection or ask a question as well. And let me invite you to, we have to take one of the microphones. Let me invite you to come over to the stand here. But Andrew, I think you were. I was
going to take my professional public health hat off, and I was 19. Sex was scary, fear-inducing scary at 19, and it was not how sex should be at 19, 20, 21. And then fast forward a little bit, and then you could get a test, but you had to wait 2 weeks for the result of the test. So for folks who get a test now and you get it in 20 minutes, think 2 weeks while you sit around and get that test. And then test positive, then you have to disclose. So there's always been this undercurrent of fear that you deal with as somebody in a community where there's a high level of HIV. Am I exposed? What did I do? Did I do something stupid? Once you have it, managing it, and then still having to disclose. I've been positive for 20 years, but I still have to disclose. And depending on the audience aware, there's a knot of something in my stomach still to this day about having to disclose. Yeah. And that doesn't go away.
Before you say that, I am going to invite people to come up, but you've also received cards when you came in. And we are, in just a few moments, going to acknowledge individuals who have passed on. If there are names of individuals in your life that you would like to have remembered at this particular time, let me suggest you write just only one name on your card and to pass those cards forward, and we'll use them in our program in just a few moments. Gary?
I want to applaud also BU School of Public Health and the work that was done here early on. And I see Rob here, and I think it was Gail. Rob, you have to help me with Gail's. She was associate dean who was here, Ron.
Gail Douglas.
Gail Douglas. One of the first, I had an adjunct assistant faculty appointment here at the School of Public Health, teaching in the AIDS certificate program, teaching people who are going to go out and do work in the community, and particularly in communities of color. And that came out of BU. That didn't come out of some of the places, I'm not even going to say what other places it could have come out of with schools of public health, but you can guess. But it came out of, that are near me, but it came out of this school and the importance of that program of really getting people on the ground who were going to do that kind of work, many of whom had AIDS and HIV themselves, to go out and do that work in their own communities was so important. So I want to applaud BU School of Public Health for that.
Thank you, Gary. Yeah.
Well, in the early 1980s, I was working as an emergency medical technician. Currently, I'm a local public health officer. But here I was reminded of an experience I had where I was working, I was on shift, and I was asked to report to a police station garage. When I arrived, there was a sergeant whom I had worked with on a number of calls and who I had come to depend upon, and there were officers superior to him in rank. And as the story was told to me, well, first I was asked to talk to them about AIDS. And of course that surprised me. In a garage, being asked to speak to several officers, superior officers, ranking officers in police department. And I said, well, sure, but where do I start and why? I had been an EMT since 1973, and I had made it my business to learn something about what we do. And as the story was told to me, the sergeant had been on a call, and a woman who was being unruly spat upon the hood of his cruiser and said, "I have AIDS." And here he was, refusing to drive the cruiser. I don't know how he and the cruiser got to that garage. And I wonder if I can convey to you the feeling I had as I looked in the face of this man whom I had depended upon in some dicey situations, someone who I could depend upon to protect me, watch my back, and to assist me if a stretcher needed to be, to have another pair of strong hands. And the face that I was now looking into was one of impotence, fear. And now I felt quite impotent that I could not assist this man whom I regarded quite well to relieve his fear. He looked frozen. And I told him the facts as I understood them, that this was a non-threat, someone spitting on the hood of a cruiser. As I understood it later, he received a reprimand in his personnel file. The car was brought to a car wash. He was given a different cruiser to drive. And it was certainly quite a few years before that police department, it was not Boston, got training and awareness throughout the ranks. And certainly the issue at that moment was not AIDS, it was fear. Fear of the unknown, fear of whatever was driving him. So it causes me to reflect that we cannot treat or medicate fear. We can address the issues that come to us, such as AIDS before us right now. But that fear never ends, and I certainly don't imagine that it ever will. Thank you.
Thank you very much. David.
Hi. I warned people that I was going to speak the truth. So I would say we are all old, Harold. And I first met Harold when he was a volunteer on the AIDS hotline when he had just moved to Boston from Texas, I believe. and I wanted to address Pat's projection of what my thoughts were when I was interviewing her, because that's not what I was thinking.
Tell them what you were doing.
She remembers that I was picking lint off my socks. I'm a really good interviewer. I wanted to just address a couple of issues that sort of haven't come up so much. One, a lesson that I learned from Larry Kessler around advocacy. When there was no state funding, he and I'm blanking on his name from Mass General, who was one of the major researchers, would go to testify at the legislature. Larry would advocate for funding for research. He wasn't a researcher. And the physician from Mass General would advocate for services and prevention education. And it was a lesson that I learned that you can share this advocacy so that it's not seen as, self-serving. And that was very helpful. When you showed the picture of Belinda, one of my great memories of Belinda was sitting in her office. She was practicing a presentation. She did, in addition to all the things that were mentioned, she did sex education, particularly with groups of African-American women, often in church groups. And she was practicing how to put a condom on a banana to be able to demonstrate. And this was the first time she was about to go do it, and she couldn't stop laughing. So I wanted to say that. The other thing is, in that period between the identification of HIV as the cause of AIDS and the first medication, AZT, it was really, it felt like a hopeless time. There was nothing you could do except try to prevent, but we didn't really know what was causing. So the fear that people felt there in the early to mid 80s, in a way, was justified. I think it was overblown. With Ebola, we knew that hazmat suits actually were necessary because we knew how it was transmitted. The hazmat suits that Harold was and Gary was talking about was just out of fear of the unknown. When AZT was released, the first federal funding for what has become the HIV Drug Assistance Program was a $25 million federal allocation that Senator Kennedy had introduced. I remember, there's one person I want to mention is a woman named Henya Handler. So Henya, at the time, she then became the Director of Governmental Affairs at Fenway Health for many years and just retired. But then she was working in the Department of Public Health. And I had never met her, and she asked me to come in to talk about how should we administer the money that was available for AZT. And she said, so we have to come up with income guidelines. We can't just give this to anybody. And I said, well, how about 200% of the poverty level? And she looked at me and she said, are you kidding? At least 400%. And it's just sort of that attitude that was really important.
David, I'm going to thank you for your comment. And
thank you, everybody.
Yeah, thank you.
And I was in that office with Henya.
Those stories are so incredibly important. Thank you.
I was in that office with Henya when we were part of Family Health Services before the 1990 when we had an actual AIDS program. And I just want to share a couple of memories. So going to Larry Kessler, he did some amazing things. We had that infected healthcare worker group that we went in through Hard Rock Cafe, out the back door, up the back steps into AIDS Action at night so nobody might identify someone as a health worker who was infected during the whole bloodborne pathogen proposal and coming up with the guidelines for the state. A story about Larry that goes back to advocacy at least 10 years before this is, does anybody remember, I think it was the 1968 World Series, the banner, End the War, Stop the War? That was Larry and his friends. And I think that's a great story to remember about the fact of how much an advocate he always was. Another picture missing is Carrie Duran. We talk about stigma, we talk about the FDA, and Carrie with ACT UP Boston was an incredible force for moving things here that we might not have seen. And then I just want to make a comment that hopefully a lot less dentists discriminate now than they did, because as Al knows and a lot of you know, the discrimination. In 1990, the ACLU issued a report called Epidemic of Fear, and they listed the two top discriminators as nursing homes and dentists. And being in the profession, it was an incredible embarrassment to me.
Yeah, thank you. Certainly, there are so many stories that we could share, and I think we have just one more. One more, of course.
I'd just like to publicly thank AIDS Action. My husband had hemophilia and died of AIDS in 1995, and he had his test at AIDS Action, and they were sympathetic, understanding, and really helped during a very difficult time. And I want to thank you.
Thank you for sharing that. There are many people who have been on the front line of dealing with HIV, some like Larry and Belinda, who we all know the names of, and many others who we don't know. So it's important for us to acknowledge and remember and to continue to tell these stories. These stories are critically, critically important. And I want to thank our panelists who were so willing to come up and to remember some good things and some challenging things, and for you to acknowledge them, please. Now I want to turn our program over to the Dean of the Chapel, who is Dr. Robert Allen Hill, who is going to take us through another exercise. If you have cards of people that you would like to have remembered at this time, would you please, Seth and Emily will help to pick those up. Panelists, why don't we take a seat on there?
Let me with you thank our panel. The chance to listen briefly as we prepared these moments to this circle of colleagues and partners in service was an inspiration. I carry it, and I'm grateful for that. Let me thank this gathering, speaking of spirit, and the spirit in the room. Spirit of community and a sense of empowerment. And now we're going to pause for a moment of remembrance. I want to thank my friend now of some years, Dean Harold Cox, and his guidance for this moment. And I am one of his more seasoned friends as well. Our children remind us of that every holiday. And he wisely, I think, in preparing the pattern for this moment, suggested that we pause at the end for a moment of meditative remembrance. So what I'm going to do is offer a word, ask for quiet, call for our readers, ask for quiet, and repeat, all in a pattern of for about 10 minutes, after which you're invited to go next door and to see the quilt, which some of us did this morning. It's very moving. May we add that for some of us, the remembrance is for those who have gone before us. For others, we're also remembering some who are challenged by and struggling with this same set of issues today. So we remember them too. You may be thinking of a friend near or far, and that's very appropriate. A word. Grieving involves remembering, remembering involves accepting, accepting involves a pause and then a pattern of affirmation of what lasts and counts and matters most. Let us meditate in silence. Let us remember by name.
John Wright, Natalie Silva, Jimmy Bennett, Marion Bernstein, Michael Klein, Ron Coffrin Flanagan, Elliot Cohen, Katie Petrus, Alice Nuigi, Tim Tully, Ken Gilo, Raymond Sanchez Grimaldi, Hector Luis Rodriguez, Tom Garrow.
Let us pause and remember with thanksgiving. Howard Thurman wrote, "We share with you the agony of your grief. The anguish of your heart finds echo in our own. We know we cannot enter all that you feel, nor bear with you the full burden of your pain. We can but offer what our love gives, the strength of caring, the warmth of another who seeks to understand, the silent, storm-swept barrenness of a loss. This we do in quiet ways, that on the lonely path you may not walk alone." Let us meditate in quiet. Let us remember by name.
Neil Flanagan, Bruce Cooper, Chip Hubbard, Michael Gouty, Jim, William Awad, Jim Grillo, Wendy Gaynor, Nick Mazza, George Kenny, Jim Campbell, Diana Ide, Paul Mitchell, Catherine Gaines, Belinda Dunn. William J. Creedler, Michael Peters, Steph, and Freddie.
Let us pause with thanksgiving. Dietrich Bonhoeffer wrote, "Nothing can make up for the absence of someone whom we love, and it would be wrong to try and find a substitute. It is nonsense to say that God fills the gap. God doesn't fill it. But on the contrary, God keeps it empty, and so helps us to keep alive our former communion with each other, even at the cost of pain." Let us meditate in quiet. And let us remember by name.
Dennis Greco, John Flash McClash, Todd Hutchins, Anthony DeLulo, Robert Lee.
Let us remember with thanksgiving. Langston Hughes wrote, "May the sun show warm and bright on you, your darkest night a star shine through, your dullest morn a radiance brew, and when dusk comes, God's hand to you." Let us meditate in quiet. Let us remember by name.
Lucy Muboto, Dorosa Akoth, and someone has written, "My mom's piano teacher, who she continued sending Christmas cards to for years after his death, even though they will always return to her marked deceased."
Let us remember with thanksgiving. As now we prepare to go from this place to our various responsibilities and tasks, let us do so with a sense of shared and communal remembrance and thanksgiving. And in the words of the ancient text, may these be ours today and each day, as has been expressed through the morning. Let love be genuine, hate what is evil, hold fast to what is good, love one another with mutual affection, outdo one another in showing honor, never lag in zeal, be ardent in spirit, serve the Lord, rejoice in your hope, be patient in tribulation, be constant in prayer, contribute to the needs of others, practice hospitality. And then did all the people say amen? Amen. Amen. Thank you.
Thank you for joining us today. And I invite you